Hi, everyone. Welcome back to another episode of Heart to Heart, a series where Dr. Imreen Mohammed and myself, Dr. Amisha Gupta, talk to today's physicians about why they chose their field in medicine, their interests in social media, and where they see their respective fields going in the future. And today we're very excited and honored to have our friend and our colleague, Dr. Jennifer Chung. Dr. Chung earned her medical degree from Drexel University College of Medicine and completed residency training at New York University Langone Medical Center, where she also served as chief resident. She's a member of the AMA and the American Academy of Physical Medicine and Rehabilitation, and moreover, her social media presence is a powerful force where she uses her platform for advocacy, to fight misinformation, and to really bring on the topics about equality and equity within the field of medicine. So Jennifer, thank you so much for joining us today on our Heart to Heart series.
Thank you guys so much for having me. I've been watching and following you guys for months now, just in awe of the initiative that you guys have taken and just the amazing conversations you've had. So it's truly my honor to be here tonight with you ladies.
Oh, thank you so much. The honor is truly ours. And, we like to get our conversation started by asking our guests why you chose your field and your specialty and what really started your journey in medicine.
Yeah, I mean, so my story is pretty unique. I actually was accepted into medical school when I was 17 because I was in one of those kind of 4-4 combined programs, BSMD. So I actually picked an undergrad in Pennsylvania, somewhat close to home, Muhlenberg College, that actually allowed me to major in a liberal arts, which I loved. I mean, not being so funneled into a science only. So I completed 4 years there and then 4 years in Philadelphia at Drexel, which was also Hahnemann at one point, which Imreen knows, I know, and actually where my dad trained after he moved here from South Korea. He actually ended up getting a residency at Hahnemann. So it was like full circle. I actually was born in Philly too. So, I went through those 8 years, and when I was during medical school was when, actually, I should backtrack. When I was 14 is when I developed back pain. So I developed back pain. I went through a journey where I did not have a clear diagnosis for a decade until I was in medical school. And I met a PM&R physician who thought outside of the box and ran the right blood test and the right imaging and diagnosed me with ankylosing spondylitis. So it was 10 years after my initial symptoms. And so he ultimately became my mentor, just the fact that, working with all these different types of healthcare professionals and nobody gave me, there was no solution, there was no answer. And so then he kind of opened up this world to me, and that's ultimately how I pursued PM&R. And at this point, I'm specializing in spine and musculoskeletal medicine, more holistic pain treatments, because I was that patient. I knew what it was like to have pain, debilitating pain, and what it does to your quality of life and the people around you. So that's basically how I found my specialty. But I was really young when I found myself on the medicine track, and did I really know at the time that's what I wanted to do? But, it truly ended up working out the way it was supposed to, because I genuinely love what I do.
Yeah, absolutely.
Yeah. And, I think it's, go ahead.
I was just gonna say it's, one of the reasons why Amisha and I started this series is really to showcase that not every physician, has that straightforward path to medicine, and I think it's really important, especially for our audience, which is primarily a younger audience of students and trainees, to show them that, people, don't necessarily have the straightforward path. They don't necessarily know if they even want to go into medicine. Sometimes people just find themselves in certain situations, have to go through, different hurdles. For you, it wasn't, a lot of times we hear like, oh, my dad or mom or both my parents were doctors, but it wasn't just that for you. It was more so you kind of going on this journey of this, having this back pain, not knowing what it was for such a long time, which ultimately led to a diagnosis and ultimately led you to specializing in PM&R, which is absolutely amazing. So I feel like with your patients, you have a different perspective that you bring to the table because you've kind of been through this, unique journey yourself.
Yeah, and that's the thing that patients in pain, whether it's acute or chronic pain, they just want to be heard and they want to be validated. And I think so easily in our culture today, with the opioid crisis, that too many physicians just when they hear pain, they just dismiss them, and so for me, there's always solutions, there's always management options as long as the patient is motivated. And I can tell you, 95% of the patients that come to me are motivated. And I mean, even if it's just changing their pain score by a couple points, it's still an improvement and that gives them hope. But what I do want to say is, I will be honest, I don't know that I knew in my heart that I really wanted to do medicine. And I'm sure I'm not alone in the kids that go into these 4-4, 4-3, or 4-2 tracks. Because do we really know we want to do medicine at the age of 17? We don't. And I don't think I knew. I mean, my dad is a physician, in our culture, the Asian, in our generation, we're basically taught medicine, law or engineers. And so I felt really goaded onto that path. And I think at some point through college, through medical school, I was angry a little bit. I felt like I didn't make the decision for myself. And that was a form of rebellion in my mind. And it wasn't until, and for me, I'm so grateful that things worked out the way it should, because once I kind of let that rebellion fall to the wayside is when I really understood that it was meant for me. And finding PM&R was truly exactly where I should be. So I'm beyond grateful for that. But if I had children, I wouldn't encourage that kind of that track at such a young age, because you really, I mean, you need those college years or sometimes after college years to truly explore and figure out who you are, what your passions are. So for me, I'm internally grateful that things worked out the way that they should, but I can certainly understand why some of my, the other students in my program dropped out or changed their mind, because 17 is just simply too young. So as you guys talked about, there's so many different avenues to get to medicine. And I truly think the most effective way to do it is once you know who you are, you know yourself, what drives you. And that's to me generally is the most successful physicians.
Absolutely. And I think it's, like you said, thinking outside of the box, and it's okay to not have all the answers because yes, in our cultures and also just by the medical algorithm, we're supposed to follow these steps and know these things. And yes, to a certain degree, right? We have to master certain elements to get to the next stage. But like yourself, you chose an unconventional major where now that's encouraged, to not just do a biology major, but to take your pre-med classes and explore your other interests. But you did that before it became encouraged. And I think that the underlying theme is that, we need to continue to encourage people to make those decisions for themselves, and to also, appreciate that there's highs and lows in everybody's journey, and it's okay for your own path to deviate and for you to change your mind.
Absolutely. And I think that was fortunately one decision on my end that really worked out at such a young age, was making sure that I had the ability to major in a non-science, because I always loved a variety of things. I mean, I took literature classes, I took modern dance classes in college. I mean, if I was all pre-med, there was no way I could have explored some of those, unforgettable opportunities that, during those pivotal kind of years, so I'm really glad I did that. And I'm just so grateful things worked out, because they certainly could have turned very differently, but as we mentioned, I think with my experience with pain, we talk about, I feel like medicine has become so black or white, when in reality, COVID has shown us there's so much we don't know. And so the way that I approach my practice and my patients is, there's absolutely a gray area with the human body. And, I'm very open with patients about that. I'm never going to kind of box patients in because again, we have to do what's best for the patients. And for me, there's still so much of medicine and the human body we don't know. So, it's fun, it's exciting, it's seeing patients get better and have a quality of life they haven't had in 2 decades. I mean, I've had several patients that have experienced that. It's so rewarding. And that's why, I mean, I just encourage people, med students, go after what drives you, what really fills you, because it's every day for the rest of our lives, or at least until we retire, right?
Oh yeah, absolutely. And so, speaking about your work, so obviously you're not on the East Coast anymore, and you're based in Ohio now.
Yeah.
Tell us a little bit kind of about the journey from going, like what made you go to the Midwest of all places? Not that the Midwest is bad, it's not bad.
Not at all.
And what made you choose, because I know that you do private practice, so what made you choose academic versus private, as well as how would you kind of describe your work-life balance, and what advice would you have for others that are seeking a similar type of lifestyle?
Yeah, so again, life has just a way of working out the way it should. I, born in Philly, I grew up in New Jersey, med school back in Philly, and then residency in New York City. And then my personal life took me to Cincinnati, a place I never thought that I would ever end up. And, I stayed there for a few years. I worked at a job I really did not like. It was more chronic pain, but it was presented to me as a very different experience. So, my first job was not at all what I wanted. And then it's actually a nonprofit hospital. It's called the Christ Hospital in Philadelphia. They reached out to me, and they wanted me to basically create their outpatient PM&R practice. So I am actually working with a hospital, but it almost feels private practice-y because they give me so much autonomy. And it's been really amazing. I mean, it was difficult. It was very difficult at first, because a lot of people didn't know what PM&R was, and it was the first. So I was building a lot of that program, but it's 7 years in, and it is, I mean, I'm really proud of how things have turned out. The one thing with PM&R, so at the time when I was in residency, initially I thought that I wanted to do a lot of the interventional spine and pain, but at the time with my AS, I just didn't know kind of how things would look. I mean, could my body handle lead for hours every day, So I actually did match into a fellowship, and I ended up not going the fellowship route. So now I do a lot of, treatments with ultrasound guidance, not with fluoroscopy. And after my first experience with chronic pain, I avoid opioids at any length because I don't believe in them either. But, it is something that since I have the autonomy, I have the ability to tailor my schedule any way I like. So to me, that has been invaluable. And when my personal life changed, I had family and friends asking me if I would move back to the East Coast. And I knew where I was working was so unusual. And I was really happy there that I wanted to give it time. Just because my personal life changed didn't mean that I was going to abandon this career that I loved. So I stayed. And then ultimately I met my now husband. And we love Cincinnati. So, things just work out the way that, I'm happy with the way things work out. I don't know how I necessarily feel about fate, but, it worked out. And I'm really grateful in a city I never expected to live in nor fall in love with. So for me, work-life balance has always been incredibly important. If you know me on social media or in person, family and friends, incredibly important to me. So it was not something I was willing to compromise. And academics, the university in town wanted to hire me, but it just wasn't, I knew I wouldn't be able to have that balance. And so I stayed in a job that allowed me the flexibility and allowed me to have that balance, because without it, I wouldn't be able to be a good physician. My patients would get less of me if I wasn't as balanced as I am. And that's my perspective.
Yeah, I think it's such a great perspective because we don't get enough of these perspectives when we're in training, right? We're only really exposed to wherever we're doing rotations. And I think with that, advent and popularity now of medical professionals being more open on social media, it's allowing for these perspectives to really be shared so that people can develop their own path. And nobody, we have to continue to say that, it's not easy. Medicine's not easy. What you want out of life is not going to be easy, but it's doable. And it can be found sometimes in the most unexpected ways. But when we see other people doing it and sharing their perspectives, I think it gives people hope into kind of deciding what their own path will look like. And that gets me to my next question for you. Because of social media, you've been able to share a lot of your story and really, what's important to you. So what got you started on social media? Where do you want your platform to grow? And what type of advice would you give for other medical professionals of all ages who want to get started?
So I actually was always really private on social media. I had no awareness of this medical community at all. What ended up happening actually at the beginning of March of 2020, I was involved in a community panel discussion with a few of the other spine and orthopedic surgeons open to the community. And the questions that I got and the feedback I got from the community members who attended made me realize how little people knew about pain, non-opioid, non-surgical pain options. That's actually what prompted me to open up my account. So I wanted to actually be an advocate for patients that didn't necessarily have great access to physicians. So that was March 1st, 2020. And then 2 weeks later, it was like COVID just took over. And so what I started to realize was obviously, battling misinformation, sharing what's, up to date science data, because as we all know, the misinformation is rampant. And also for selfish reasons. I found a community where I was able to find support, during such a nebulous and scary time, and, get answers and just lean on each other. And so that was kind of where it started to segue. And then George Floyd happened. And then it was like, for me, it was like, I have this voice and I feel like we have to kind of stand up for what's right. And then just all, the cascade of events. And I started to, and I was shocked. I'm getting to 500 followers initially. I was like, oh my God, 500 people want to follow me, and then, for me, it just started kind of building without me not really understanding like how this is happening. But, I think the biggest thing is I've always been really authentic to myself. I think that who I am on social media is exactly who I am. And what I've realized is just, if any of us have a voice, whether it's, a small voice or a big voice, whatever it is, we have to use it for what's right. And, I know a lot of people feel as if the social issues it's not our place as physicians, but it absolutely is our place, because this can happen to any of our patients. We see healthcare disparities, inequities with our patients. So it's absolutely our place to speak up and stand up for what's right. And for me, I wasn't even aware of my own implicit biases until after George Floyd. And so when I look back in almost embarrassment and horror that I went through my entire life not even realizing that I carry these biases. So if I was able to see it, maybe the person down the street can, or the person across the world can. And it could be from any of us just having that conversation. And so I still don't necessarily know what direction to take my platform, because I really don't do anything with PM&R, because I feel like there's just a never ending cycle of social issues or COVID. But I'm just going with it. I luckily I can compose my posts really quickly. And I just kind of, just write them pretty quickly that day. But it's, for me, it's just our obligation, and I don't care if someone's going to stop following me. I don't pay attention to that. It's kind of what I believe is the right thing to do.
Yeah, absolutely. And I think, Jen, one of the things that, and I'm so fortunate that I've been able to meet you as well in person. And I really can attest to the fact that the person that you are in person is the person that you are on social media. And the thing is that, people oftentimes don't have that type of personality, unfortunately, right? So, I think that, being authentic is one of the best things that you can do, especially as a physician. And that, like you said, and you're absolutely right, is that we have a responsibility to the public to talk about not only medical issues such as COVID and, things within our own specialties, but we have a social responsibility too, because we have patients from different backgrounds and we want to make sure that everybody is treated as equally as possible, because these situations, and we're people at the end of the day, like we're humans.
Absolutely.
We're not
Right.
robots, we're not in a box. And we should be able to speak about these issues, to treat our patients equally, and to also be able to live in a society where we have equality. I mean, it's just so incredibly important. And if we're not aware and we're not speaking about these things, how does that, what kind of perception do people have of us? It's like sometimes I feel like we can't win, right? It's like you're damned if you do and you're damned if you don't.
Which is why just be your authentic self. I mean, at the end of the day. And that's the thing, I think, and both of you guys you do this as well in terms of all our vulnerabilities. I think too many people on social media present their best face. And then, whether it's medical students or college students, they see us in this static place and time now. And it's important for us to talk about our battles, our journeys, to get to here. Mental health, fighting racial, gender inequities, harassment, discrimination. We've all experienced.
So, Jen, we were, talking about your social media platform and, the various ways that, you use it. So I'm curious, and, obviously Amisha and I know a little bit about this, but, what kind of collaborations and things have you been able to be a part of on social media that have, really brought to light diversity and inclusion? And how do you think that moving forward, especially in medicine, we can further diversify the field, and also within PM&R, because I'm not really sure in terms of, the ratio of, male to female, and what type of, healthcare disparities are within your own specialties, if you want to speak about that as well.
Yeah, I mean, so actually, when I joined, there were a few collaborations. I was such a novice when I started last year, but for our Asian American Heritage Month, I actually put together a video. I reached out to different, Asian American physicians. We did one for Black Lives Matter after George Floyd as well, and which those videos take a lot of time. And for somebody who was like a tech novice, it was pretty challenging. But again, I wanted all of us to kind of show solidarity in these times of crisis. After the recent uptick in Asian hate crimes, and I started seeing like a widening divide between the Asian and the Black communities, I felt really compelled to start a dialogue. And that's actually when I met Dr. Gerald Unahu, who had created Everybody Versus Racism. He actually created that after George Floyd, but I had never come across him or the page. And we decided to kind of become, one front. And we gathered a group of Asian and Black healthcare workers to have these kind of open dialogues, with the ultimate goal of discussing the complex history between the communities, and then ultimately how do we try to heal and move forward? Because again, as the account says, it is everybody versus racism, and if we're pitted against each other, how do we make progress? So that's been really amazing. I mean, and with the conversations, they're all saved. They were IG lives. They're all saved at Everybody Versus Racism, and there were a lot of healing that was taking place, just having the conversations. So for me, if we want to see change, that having the dialogue is the most important step. Spreading awareness, making sure that it's not, we don't stay quiet anymore, because Asians tend to stay quiet, right? And so we've started this movement. There's more projects to come, and I'm excited, and hopefully you guys can continue to help support that as well. In terms of PM&R, I think it's pretty evenly distributed. If we look at the subspecialties, interventional pain and spine is probably more male dominated. And I feel like we see that a lot, right? More procedure-based specialties tend to be more male dominated. I think that social media has opened the conversation for women empowerment, that the things that we experience, we're not going to just accept any longer, that women can do these amazing procedure-filled specialties and be successful like you two. It's just letting these girls know that they can do it. And I think that that's, again, the power of social media. And I love being a part of that because we got to lift each other up, right? And we let our girls know that they can do whatever they want. And, you know, I'm so excited for all the things to come in that regard.
Absolutely. You know, and I think it's like you said, I think a lot of people, including, you know, myself, with social media, we're such passive participants for such a long time. And I think, you know, and anyone can do what they want with their social media account, but I just think having these discussions, these conversations, these dialogues, these visual representations, I think even for participants of social media who, you know, may not want to be public, I think, you know, at least that that information and that education is getting out there in some way and form, and it's not just behind a closed door anymore or in a box or in a silo. And so I agree. I do think, you know, with everything going on, and especially with the past year and how difficult it's also been enlightening, educational, and you know, and a couple years of growth, you know, for I think the whole community.
Yeah, you know, I just think back about when I was, so I'm sure I'm older than the both of you. So when I think about when I was in med school or training, I'm turning 41 this week, so I I think I'm older. But you know, there was none of this, and I feel like I felt isolation throughout med school and residency, and I feel like just this community and just having this incredible network and understanding so much more. I think that just us doing our job, you know, and giving back to the generations after us, it makes a world of a difference because medicine can be so isolating. And I would this is purely a guess, but I can imagine that at any point in every single one of our journey with medicine that we've all had some level of depression, anxiety, you know, feeling like not good enough, you know. So but to have seen so many to see attendings, to see, you know, successful physicians say, hey, I was there, but I made it, you know, and you can too, I think is going to change the landscape of medicine. And it's just amazing. And again, you know, with social media, to me, don't focus on, to me, it's like, don't focus on a brand necessarily. Just focus on just focus on what you're genuine about, you know, and what really speaks to you, because I think that that's the best way that you're going to reach people. You know, I think some people get really fixated on whatever a brand is. We're not here to be influencers. We're physicians, right? And our goal is to make people's lives better. And if it goes, now we have the ability to do that beyond our patients. So whatever it is that, you know, you're passionate about, I think that that's how you should use social media. Just be authentic, be yourself. And I think that, I don't know, like I've never thought about anything else with social media beyond that. And I'm grateful that there's people that, you know, support it and identify it. But you know, I said this in one of my posts, if you're an empath, you're probably following me, because I do think that that's kind of what my platform is just be kind, be a good human, you know, just like you two. I feel like you two do the same.
Thank you. I mean, we don't have enough of that, I feel, you know, and I think you gave a lot of good advice, you know, during this whole talk that we've had. But, you know, one of the best things I think that you said is just to be really genuine to yourself, especially when you are on social media, because, you know, you can get so easily lost in the minutia, right? You know, so-and-so is posting this. Why am I not getting as many likes on my thing? The freaking Instagram algorithm that none of us can understand, right?
Right.
It's constantly changing. Why am I not having any growth? I mean, we've all, you know, had conversations about this, and, you know, you feel a sense of imposter syndrome. You know, my colleagues are doing better than me, or I'm not smart enough to post this. I mean, you know, I've had so many of these thoughts like in my head, but I know when I reach into myself and I talk about mental health, for example, you know, that's something that resonates very deeply with me, with you guys, it's, you know, things that are unique to you, you know, as well. Those are the times that, you know, you're not really thinking about like, oh, I'm going to get these many likes or whatever. It's just about something that you're feeling. So to come from that perspective and try to do that all the time, you know, I think you'll definitely find your path. And you know, so we're so incredibly grateful to have you. You're so well spoken, and you're able to really articulate yourself so well. You know, and I feel like we could just talk forever and ever, but obviously we all need to go to sleep at some point. And you're missing your family, and you know, you respect your family time.
It was cute because if you see my eyes darting to the side, it's because my 11-year-old niece was just watching. I didn't think that she would still be up, but she was. The one thing that I want to say is, you know, if you find yourself in that pattern of comparison, if you find that anything you're doing on social media is not making you feel good, you should probably take, not you specifically, but in general, take a break, you know, because then you're getting caught up in the wrong things, and it's actually going to affect your own mental health. You know, this is just one aspect of all of our lives, and there's a purpose for it, right? But if it, you know, anything negative from it, then it's certainly time to take a step back and maybe do some reflection, because I don't think that social media is for everybody. If you can't have a healthy relationship with it, again, you're not serving anybody, including yourself. So I think that that's an important message for everybody to remember as well.
Yeah, absolutely. Gosh, girl, you're just serving them with all this great advice.
Well, thanks for having this conversation. I adore the both of you. I think you guys are amazing. I love seeing the entrepreneurial spirit, and you guys are as real as it gets. And you know, thanks again. It was a true pleasure.
Well, thank you so much again. And, you know, thank you everybody for joining us. We hope that you learned something. We know that you learned something, and you can find Jennifer Chung on social media, especially Instagram at Dr. Jennifer Chung. And thank you again for joining us, and we'll see you back on another episode of Heart to Heart. Have a good night, everybody. All right, we're ready. I'm going to have to edit this.
God, I thought we didn't start recording yet.
Okay.
Sorry.
I'll send you the blooper. It's hilarious. All right, let's go.
Oh my God. Okay, Abreed, got it?